Hello, my name is David Meach. I'm an advanced physiotherapy practitioner, and in this role I'm used to providing lots of advice to patients with established musculoskeletal complaints. You're about to watch one of the videos that I've made for people who want to try to manage their condition with trusted advice and exercises. I've tried to sequence the exercises in the most logical way using my experience, so that they are as effective as they can be. This does not take the place of medical or physiotherapy assessment or indeed hands-on physiotherapy treatment, but I hope it goes some way to helping you better manage your condition independently. Watch the video carefully for the correct technique on how to perform the exercises. For each exercise, there is instruction on how many repetitions to do and how many times to repeat each set of exercises. Don't worry if the exercise causes a little mild discomfort, as this can be normal, but stop if you are concerned that your condition is worsening. Exercises can take a few days to a couple of weeks to take effect, so don't worry, but please try to persist. Seated heel slides with towel. While in a seated position, place your foot on the top of a small towel or plastic bag. If you have a carpeted surface, then slowly slide your foot closer towards you. Hold a gentle stretch, then return the foot to the original starting position. Repeat 15 times and complete 2 sets. Here's the video. So gently sit with your foot sliding on a towel or other material to reduce the friction. Just get into a gentle rhythm and increase your confidence with knee bending. Heel slides supine. Lying on your back with knees straight, slide the affected heel towards your buttock as you bend your knee. Hold a gentle stretch in the position and then return to the original position. Again, repeat 15 times and complete 2 sets. Please note you can be sat up rather than lying down for this exercise, but we'll watch the video. So the model is lying down. You may choose to sit up with your back supported. Just get into a gentle rhythmical motion, confidently increasing the degree of knee bend. This has many benefits for the knee and the surrounding tissues in the acute, early or significantly painful phase. Heel slides. Long sitting with towel and belt. A good one to practice. While in the sitting position, place a small hand towel under your heel. Next, loop the belt or towel around your foot and pull the knee into a bent position as your foot slides towards your buttock, and hold a stretch and return to the original position. Repeat 15 times. Hold each one anything between 3 to 5 seconds and then release. So use a belt and a sliding material if required to bend the knee towards your chest. Use a combination of your own leg action to bend the knee and your arm action to pull the knee, and see if you can hit that sweet spot by getting more movement gradually, building your confidence and reducing your pain as you build up the repetitions. Calf stretch with towel. While in the seated position, hook a towel under your foot and pull your ankle back until a stretch is felt in your calf area. Keep your knee in a straightened position during the stretch. Repeat 3 times, but each time hold the stretch for 15 seconds and complete 2 sets. So gently pull the calf towards you. Have the other knee bent to take strain off your back. Stretching the back of the knee via the calf can really help the knee to settle. It can take quite a degree of ache away from the knee and help the knee straighten more readily when walking. It's a common stiffness experienced in early arthritis. Quad set, towel under knee. Place a small towel roll under your knee. Tighten your top thigh muscle to press the back of your knee downwards whilst pressing on the towel. Repeat 15 times. Complete 2 sets. So the emphasis is going to be using your thigh muscle to press down on a towel behind your knee. In the early stages of knee pain, quite quickly your thigh muscle or quadriceps turn off, and it's important to do simple exercises to re-engage them into activity and support, and this can be quite effective. As you press down, the foot might lift a little off the bed. This is a quad set, but this time with the towel placed under the heel. So while lying or sitting, small towel roll, this time under your ankle. Tighten the top of your thigh muscle, the quadricep, to press the back of your knee downwards, again towards the ground. And the effort is produced by your thigh muscle, which you should see and even feel contract. This can take tension out of the back of your knee when done over a few repetitions. You're repeating this 15 times in 2 sets. If you're very tight, don't force this, just let it come gradually. It's not a race, just build up the degree of stretch behind your knee, and you're providing the tension from your contracting thigh muscle. Again, this can be done sat up so you can see the muscle in play. Short arc quad or vastus medialis. Place a rolled up towel or object under your knee, and the key here is to position your leg rolled out to the side. Your foot should be pointed out to the side at around 45 degrees, and then begin to straighten your knee and your foot will rise as your quadriceps contracts 15 times in 2 sets. Watch the model. Can you see how the right leg is turned out to around 45 degrees? And this places some emphasis on the medial quad or inner thigh quadricep muscle. And this can be a very successful exercise to get that muscle to engage around a painful knee. And you will feel the contraction, and this will bring confidence. The last exercise is one of my favourites as a physiotherapist. It really can be very effective. So, start in a standing position with the ball behind your knee against a wall. The knee should be partially bent. Next, press the back of your knee against the ball while you try and straighten the knee against the resistance of the ball. Particularly what I like about this exercise is that you are standing. So as you're doing this, you are weight bearing through the knee. And that's quite a meaningful sensation, and that enables quadricep contraction. And because you've got some resistance provided by a soft ball, it is considered to be an early strengthening exercise. Note the other heel is slightly forward. The action leg has the heel close to the wall. The hips are resting against the wall during this exercise, and you will feel some fatigue in the action leg. Most patients give very good feedback about that exercise. So that's it. I hope you enjoy them and do them regularly. This is the worksheet to accompany the exercise videos. If you would like a copy, just email me at the address shown at the end of the worksheet video and I will send a copy directly to you. Make sure that you check all of your inboxes, including your junk mail. Here is the exercise document. It runs over 3 pages with the exercises clearly laid out and the text easy to read and a clear indication of the repetitions and the sets. At the bottom of this document we'll place the email address that you can send an email to in order to request a link to this document by email.